Hello, everybody, and welcome to this month's IMV Imaging Journal Club. My name's Sam. I'm one of the vets here within IMV, and this journal club is my choice for this month. So, if you're just joining us for the first time, welcome. If you've never been to Journal Club before, just a quick recap of how it works. Every month, the IMV team will choose a paper or critically appraised topic, and they will present that in a presentation, which we put out monthly. It's just free to view on demand as well. So people are more than welcome to watch that, have a look at the research summary, and get our thoughts on this piece of recent research. After that, if you want to get in touch, we always love to hear from anybody. So if you want, you can put a question in the Q&A box. That's the little speech bubble with the question mark icon on the toolbar to the left of the screen. You can also send any comments or queries to clinical@imvimaging.com. We'd love to hear from everybody. As I mentioned, this month's paper is my choice. So I chose a paper from Veterinary Radiology and Ultrasound. It's quite recent, titled Ultrasonography as a Sensitive and Specific Diagnostic Modality for the Detection of Ectopic Ureters in Urinary Incontinent Dogs. So this is an open access paper. So if you are interested in it after the presentation, I encourage you to go online. You can find it. It's really available, so you can check it out yourselves if you want to read through the research and form your own opinions. So just to recap by talking a little bit about ectopic ureters. So ectopic ureters is the most common cause of incontinence in juvenile dogs. As you're probably aware, with ectopic ureters, they can be classified as being extramural or intramural. Intramural, where the ureter still joins the bladder at the trigone area, but then travels to distal part of the urinary tract. And extramural, where it bypasses that trigone area and then joins the distal urinary tract at another part, the proximal or urethra or the mid-urethra or the prostate are examples of potentially as well. And female dogs are overrepresented and more severely affected, which is just sort of theorized being as a result of their anatomy, that relatively short urethra as well. And there's a genetic basis for ectopic ureters proposed in some breeds, especially golden retrievers and Labradors are overrepresented. You get other breeds such as Newfoundlands, Huskies, Poodles, etc. as well. So understandably, diagnostic imaging forms a very important part of our diagnosis in cases of urinary incontinence where we suspect ectopic ureters. So classically, the diagnostic modality used was contrast radiography. So we use excretory urethrography combined with sort of retrograde urethrocystography as well. And that correctly identified ectopic ureter orifices in about 66 to 78.2% of cases as well. More recently, these sort of other modalities have sort of come to the forefront. So CT is used much more commonly now using excretory urethropy or four-dimensional excretory urethropy, which has a sort of higher sensitivity than contrast radiography. And then the gold standard is considered to be cystoscopy because it's 100% specific as well. There are some downsides to each of these sort of modalities for diagnosis, in that they require a general anesthetic or very heavy sedation, and they often require contrast administration. And contrast administration has a low risk of allergic reactions, but is also contraindicated for kind of cases where there's renal compromise as well. So one of the big benefits of sort of ultrasound that the authors of this paper are keen to kind of highlight is that ultrasound can be performed without relying on a GA. It doesn't require contrast administration. So there's a bit of advantages there. So the aim of this study was to evaluate the sensitivity and specificity of abdominal ultrasound for diagnosis of ureteral or ectopia in dogs with urinary incontinence presenting to a referral institution, and using cystoscopy findings as the kind of gold standard for comparison. And the authors hypothesized that ultrasound would have a sensitivity of greater than 85% when compared to cystoscopy, and they had a secondary aim to assess whether there was other ultrasound findings that could be useful in aiding the diagnosis of ectopic ureters. Just to detail the method and talk about that a little bit, this was a retrospective descriptive study. So it's cases presented over a 6-year period at a sort of university teaching hospital, cases presented for urinary incontinence. The cases were included if they had both ultrasound and cystoscopy during their investigation. There could be quite a significant time period between techniques, so it could be up to 3 months between the techniques as well. But cases were excluded if they'd had other imaging modalities performed. For example, if they'd had radiography and contrast radiography studies performed, they were excluded because that may cause kind of bias or affect the sort of the interpretation of the ultrasound findings. And they also avoided cases of previous urinary tract surgery, probably because that could introduce sort of physical abnormalities that they could mistake for some of the signs of ectopic ureters as well too. And what they did is they used the ultrasound to look at the ureters, and they looked at whether they could grade them as being intramural ectopic or extramural ectopic or normal. And they also recorded any concurrent urinary tract abnormalities, what they called CUTA, and also if those abnormalities occurred on the ipsilateral side, i.e. the same side as the ectopic ureter was reported on as well. And then cystoscopy was used to then classify each ureter as either ectopic or non-ectopic. Just looking at sort of some of the results and kind of going through the method just so we know. So the study had 46 dogs in the initial sort of survey population, but they excluded 6 that had had radiography performed and 2 that had had previous surgery. So the study population after those exclusions was 38 dogs. Interestingly, it was sort of 31 of those were female entire, 6 female neuter, and 1 male entire, and a median age of 5 months. Just coming back to that sort of start when we talk about ectopic ureters, very much that classic population of sort of young female dogs as well. Just to look at the sort of method a little bit more for the ultrasound specifically. So the ultrasound was either performed consciously or with light sedation, depending on the temperament of the dog. They used B mode and Doppler to try and identify the ureteral openings as well. Doppler was used to pick up the ureteric jets, so those peristaltic jets of urine being introduced to the bladder lumen. And if it was difficult to identify those initially, some of the patients were actually given furosemide at 0.5 to 1 mg per kg IV to aid identification and also of the ureteric jets. And this does it partly by reducing the specific gravity of the urine entering the bladder. So as you may be aware, with ultrasound, the kind of creation of ultrasound echoes is dictated by the acoustic impedance of different substances. And when we're dealing with a fluid like urine, the specific gravity is sort of partly related to the sort of density and therefore the acoustic impedance. And the greater the difference between acoustic impedances, the more chance we'll get echo kind of created, so that greater contrast of ureteric jets. So that's essentially one of the sort of reasons behind using this furosemide, is to actually affect the specific gravity of the urine coming in, so the ureteric jets look more obvious and create a greater energy echo. So what they did with the ultrasound is they were looking for a lack of ureteric jets. Hopefully the video that we can see on the right of the screen will play, but if it doesn't, it's just showing those little kind of classic puffs of smoke we see from the peristaltic jets entering the urinary system as well too. They also looked for the visualization of a tubular structure entering the urinary tract distal to the neck as a sort of way of checking that there was ectopia there. So the ureter joining the distal urinary tract away from the trigone. They looked for ureteric papillae distal to the bladder neck, and they also looked for those ureteric jets using Doppler from distal to the neck as well. So they're using the Doppler system to try and highlight those ureteric jets either entering in the right area or coming from the wrong one as well. As I mentioned, those intramural ectopia is where it's implanted at the trigone but travels distally from there, and then they could sometimes visualize that by seeing the ureter itself if it was dilated. And then those extramural ureters where they looked for those jets coming from distal to the sort of trigone area but lacking a tubular structure within the bladder wall, or of actually directly visualizing the ureter, bypassing the trigone area to implant distally. So just looking at the cystoscopy, so just to touch on that, the cystoscopy is performed under GA. In female dogs, it uses a rigid cystoscope, which is advanced into the vestibule and then the urethra, following distension of the urethra and that area with sodium chloride as well. And just to kind of contrast with the approach in male dogs, a perineal approach, surgical approach is made to allow access using a rigid cystoscope as well. It is possible to perform cystoscopy in male dogs using a very small diameter flexible endoscope cystoscope, but the sort of more typical approach seems to be using this rigid cystoscopy approach from a perineal area. And on cystoscopy, they can identify the ureteral openings directly and assess the lower urinary tract. So it's all about directly visualization of the ureteric openings. And one of the advantages with cystoscopy is that it facilitates treatment as well, because you can use sort of laser ablation to sort of ablate the abnormal openings of the urethras, as well as directly visualize them. So just to summarise the results from the study as well, so we had the 38 dogs included in the study, so this made up a total sort of study population of 76 ureters, so 2 ureters per dog. When we're looking at the ultrasound itself, there was 4 ureters they couldn't visualise by abdominal ultrasound, but they were subsequently visualised using cystoscopy. 72 ureters that were visualized by abdominal ultrasound. Of those, 70 of them could be clearly associated with the left or right kidney, so they could trace it back to the kind of kidney. There was 2 where they could not as well. And then of those 70 that were clearly associated with the kidney, they could 40 of those were identified as ectopic by abdominal ultrasound, and 30 was identified as non-ectopic. And then the cystoscopy further categorized those. So 5 of the ureters that were identified as non-ectopic turned out to be ectopic, so it's 5 false negatives. And of the 40 ureters identified as ectopic, there was 4 that were then subsequently classified as non-ectopic by cystoscopy, so 4 false positives as well. So if we're looking at the sort of total population again in the sort of flow chart below in this slide, the total population of 38 dogs, there's 29 of them that were positive for ectopic ureter on abdominal ultrasound, 9 that were negative when we look at the dogs as individuals rather than individual ureters. And of those sort of 29, 0 of them were there were 0 false positives, so 0 that needed to be changed when they were examined by cystoscopy. But when we look at the dogs that were negative for ectopic ureters on abdominal ultrasound, there was 2 that then subsequently were categorized as being positive as well. So yeah, ultrasound was able to identify both ureters in 34 out of 38 dogs. Of those dogs, 11 of the 34 had bilateral intramural ectopic ureters, and 13 of the 34 had unilateral intramural ectopic ureters, and 9 of the 34 had both ureters as non-ectopic, so normal. And then cystoscopy of the sort of 38, it further categorized them. So 32% of the 38 dogs, 12 out of the 38 had bilateral ectopic ureters, 19 of the dogs had unilateral, and 7 out of the 38 had non-ectopic ureters. And interestingly, in cystoscopy, classified all the ureters in the study as being of the intramural type. So it did say that extramural ectopic ureters is very, very rare, sort of greater than 95% of cases will have intramural, and it certainly seems to be reflected in this study as well that cystoscopy classified all as intramural eventually as well. And this represented, as we sort of looked at the statistics from this, the ultrasound was 87.8% sensitive and 0.2% specific for individual ureters. However, when you just looked at the patient as a whole as being either positive for having an ectopic ureter, regardless of the sort of side, it was 93.6% sensitive and 100% specific. So we're classifying it as patients as positive and negative for ectopia overall. Going to look at the concurrent urinary tract abnormalities. One or more abnormality was observed in 35 out of 38 dogs. So 92% of the patients in the study had one or more concurrent urinary tract abnormality, and 100% of the dogs with ectopic ureters had a concurrent abnormality as well. So ectopic ureters had a significantly greater incidence of both urinary tract abnormalities in general, as well as urinary tract abnormalities on the same side as ectopic ureters, so ipsilateral urinary tract abnormalities. And if we looked at those features, having two or more ipsilateral urinary tract abnormalities was 54.8% sensitive and 96.9% specific for identifying individual ureter as ectopic as well. And one of the most common abnormalities was that of ureteral dilation. So you saw that in about 60% of ureters that were confirmed as ectopic by cystoscopy. So in this study, ureteral dilation was done by measuring the maximal diameter of the distended part of the urethra, or the distended urethra itself. And if it was greater than 4 millimeters in diameter, it was classified as dilated. Another very common abnormality was measuring the renal pelvis for signs of dilatation there. And again, if that was greater than 3 millimeters at the pelvic area, that was considered dilated. So they were very common observations, and you can see some of the changes just reflected in this study at the bottom as well. So we had a large number, 67% of the patients had renal pelvis dilation, 60% ureteral dilation, and the other changes such as reduced corticomedullary definition, renal cysts, uteroceles, pyelonephritis, renal dysplasia, or regular renal contours was slightly less frequently seen. So just to summarise the discussion from the paper, so as we've seen, the abdominal ultrasound is 87.8% sensitive for individual ureter, for the detection of individual ureters as ectopic, and 93.5% sensitive for the presence of sort of ectopia overall in the patient as well. It also gives some advantages in that the abdominal ultrasound allows the assessment of the rest of the abdomen and assessment for those urinary tract abnormalities as well. And as we said at the start, one of the advantages over some of the other modalities is that it can be performed with light sedation and without the use of contrast as well too. So this again comes back to one of the common kind of things with ultrasound, is that it's really available, it's significantly cheaper than a lot of the other modalities. It can be performed very safely. Cystoscopy is the gold standard. As I mentioned, one of the advantages with it is that it facilitates laser ablation treatment as well, but it doesn't allow us to assess the rest of the urinary tract. So that's where another modality is complementary, and ultrasound has a real role as well. And that's can be very useful in using another modality before cystoscopy, because we want to be able to check that there's other changes. If there's other abnormalities there, we can adjust our treatment plan. And especially in male dogs where the performing cystoscopy is more invasive and technically difficult, using assessment via ultrasound and CT can be very useful to really make sure that there's a high suspicion or to confirm the presence of urinary ureteric ectopia before we perform that kind of quite invasive sort of perineal approach as well too. As we said at the start, of the dogs in the sort of the study that were sort of positive for urinary ectopia, the majority of those were female, and the extramural ectopic ureters seem very rare as well too. So looking at just the use of ultrasound, said the diagnosis of ectopic ureters relied on identifying a ureteric jet coming from the point distal to the sort of trigone, or a tubular structure distal to the bladder neck and secondary hydroureter. So these were the things we were looking for. So a dilated ureter, that ureter being sort of visibly running distal to the sort of bladder neck as well, and then the identification of a ureteric jet coming from an area that we don't expect. Looking at the sort of abnormalities, present, if you have an ectopic ureter present, it's associated with concurrent urinary tract abnormalities, including sort of hydroureter, the bladder being intrapelvic, and hydronephrosis of the kidneys as well. And 100% of the dogs in the studies with ectopic ureters had a concurrent abnormality. And as we've just mentioned, renal pelvis dilation and ureteral dilation or hydroureter were very common amongst that. And when they were looking at these individuals for patients that had greater than or equal to 3 concurrent abnormalities had a strong likelihood of ectopic ureters, and greater than or equal to 2 on the same side, the ipsilateral side, had a strong likelihood of ectopic ureters as well too. And sort of just under 60% of dogs with ectopic ureters had ipsilateral ureteral dilation. So that's something we can look out for as well. So if you look at the images on the slide to the right as well, the lower image shows a dilated ureter. So we can see this dilated tubular structure running down towards the bladder neck, and potentially you could follow that further. Again, we're looking for that if it's over 4 millimeters, that would be the cutoff in the paper that they used for dilation. And above that, we can see that the sort of same structure at the bladder wall. So we've got that sort of utero seal type appearance where we've got that dilated kind of sort of round structure. This is a transverse plane image with the colon dorsal to the bladder at the sort of trigone area as well. So again, this is highlighting some of the changes that we might see in ultrasound that would raise our suspicion of an ectopic ureter on that side as well. One of the things to remember with the study is that a lot of dogs coming into this had been investigated for urinary incontinence and had a lot of other investigations. So in this case, they'd already had investigations, they'd already had been part of a diagnostic workup. So this is something that's going to come into it later. We'll have checked urine samples, we've done urine culture, etc., looking for other things that were causing the change in the sort of urination before we come to these investigations. Just to highlight some of the limitations of the study, it is a small study. There's only sort of those 38 dogs, so there's not a huge population involved with these. This is quite common for veterinary studies of this type as well. It's important to highlight the sort of operator-dependent part of it. As we all know, ultrasound is a highly kind of practical operator-dependent sort of skill, and that's no different in these papers where they're looking for some of these smaller changes. These ultrasound exams were being performed by sort of board certified operators as well. So there may be a different, certainly will probably be a slightly different change in the sort of sensitivity of the ultrasound when we're applying it to the general practice population, but it still highlights some of the features that we can look at and the way that we can use ultrasound in these cases to improve our suspicions and maybe guide some of our treatment decisions as well. As I mentioned, some of the dogs in the studies were given frusemide to help visualize the sort of ureteric jets. This was very kind of it was very inconsistent in how it was recorded. They mentioned in the paper, so they weren't entirely sure how many of the patients had actually had frusemide administered. So it's difficult to draw conclusions as to how much that sort of helped identify the ureteric jets and sort of how many patients that had had it. They reported for certain that one had, but they couldn't sort of say for sure with some of the others as well. And as we mentioned with the paper, it's hard to draw any conclusions about extramural ectopic ureters because there's none represented in the study. So it could be that there's different features or different changes that would be useful in those extramural ectopic ureter cases, but extramural ectopic ureters are rare. So it's still a very kind of applicable to what we may see if we're encountering these patients in practice as well. So what does this mean sort of from a clinical relevant point of view? Well, I think it certainly highlights that ultrasound is a very useful screening tool and adjunct for diagnosing ectopic ureters. Yes, the gold standard is cystoscopy, and it's going to be very useful in actually treating through laser ablation. But as we've highlighted, it can only assess a small part of the urinary tract, and ultrasound's a very freely available modality that we can use to assess the rest of the abdomen as well. So there's definitely potential for us to use this in the patients that we're seeing, where we can assess the upper urinary tract, the rest of the abdomen. So if there's concerns over the cost or the speed or the risks, or potentially deciding those next steps, ultrasound has a real role and has a real place in it as well too. And being able to use ultrasound to identify those concurrent abnormalities can be very useful. So if we've got a suspicion of ectopic ureters and we're examining the patient and we can see a dilated ureter and we could see renal pelvis dilation, it can really guide us to increase the suspicion and inform where we go next as well too. So definitely real utility in using ultrasound in these patients, especially where we might have concerns about or not be able to access modalities such as CT, excretory urethropy as well. So definitely very interesting, highlighting one of the real benefits of using ultrasound for our patients. So that's it. I hope you found that summary useful. I thought this was a really interesting paper and really interesting to look at the use of ultrasound for examining and diagnosing ectopic ureters as well. I hope you thought the same and have enjoyed it as well. This presentation, as said, will be on demand for a month, but then remember there's going to be a different presentation in a month's time. Another member of the team will be presenting, so keep an eye on our social media pages or on our emailers to just check out what's coming up in Journal Club as well. If you've got a question or comment, we'd love to hear from you. So as I said at the start, you can reach us on clinical@imv-imaging.com, or you can put a question in the Q&A box. So that's just using that question mark icon just to one side as well too. And yeah, I hope to hear from you and I hope you've enjoyed it, and we'll hopefully see you at future episodes of Journal Club. Thank you.